Thanks, Amy. Good afternoon, everyone. And thanks to Lars and Christina for inviting me here back to Sweden, to my ancestral roots. So not only is this a hard time of the afternoon because the audience starts to dwindle and people are tired, but I think I've got a hard topic because policy change, policy developments, advocacy work is hard. It is really hard to do it, to see those tangible results and to measure the outcomes. So that's my complaint for the afternoon, and then we'll get started. But before I talk about examples of what's happened in the last 10 years, and obviously I'm going to focus on osteoporosis and arthritis, because that's what I do know something about. I just want to talk a little bit about the IOF, because it's a good example of collaboration between the scientists and between the patient groups in particular. So it's a global umbrella organisation, but really bringing together the patients, the scientists, the groups, the patient groups, the healthcare professionals, and the companies as well in a global movement. And our vision, of course, no surprises, is a world without osteoporotic fractures. So really, here is the heart of IOF, but the real heart of the family are the 196, almost 200 national societies around the world. And so they're a mixture of patient societies, scientific bodies, clinical research bodies, and some of them are both. And they're in 93 locations around the world. And they work with the almost 100 committee of scientific advisors, many of whom are here today, and then companies as well, in a coalition. And our global membership, as you can see, straddles the world, and there are more national societies in Europe and Turkey and Israel, but you can see we do represent the entire globe. So the important words on this slide, if you like, are in blue, and our strategy, our objectives, which underlines nearly everything we do, is to educate everyone about bone health, osteoporosis, fracture prevention, to empower patients to take, and people to take responsibility for their bone health and their health, to work with, convince governments to make osteoporosis a national healthcare priority, and to assist healthcare professionals in whatever way that may be, in terms of scientific conferences, position papers, and research. So I'm just going to give you some examples from osteoporosis initiatives in the last decade that have been important, and some arthritis initiatives around the world. So one thing that the IOF has invested in, just particularly in the last few years, is regionalisation. Even though we've had these almost 200 national societies around the world, it's very hard to be effective in terms of policy and advocacy from an office in Switzerland. So we need regional bodies, we need our regional experts and national societies working together to increase the presence of the issue of bone health in all those regions, to drive regionally based programs with the local experts that are appropriate to the region, and analyse local issues, obviously. So we have an office in Latin America, which has been going for a few years. We've just opened last week in Singapore an office for the Asia Pacific region, and we're looking at Dubai for the Middle East region in the coming 12 months. And one thing under this regionalisation program that we've initiated, and it started with the EU, are regional audits, looking at the burden of brittle bones, the cost and the effect on quality of life in these regions. So the first one, I'll just skip over that slide, but revealing the socioeconomic burden of osteoporosis and fractures, and importantly collecting epidemiological data and trends and identifying gaps in prevention and management, of which there are many, of course, and working with governments to make policy change, and local dissemination for policy change. So probably producing these documents is important, of course, but what you do with them then is the most important thing. So spending time and considerable amount of money working, again, with the national societies to develop effective dissemination and marketing plans so that these documents are used and don't just sit on shelves around the world. So this was our 2008 10-year report, or scorecard, if you like, on osteoporosis and fracture care in the EU, which we did with our interest group and our parliamentary group in the EU. And I guess it's a bit like, not quite naming and shaming, but where is it a healthcare priority? What's happened? Has there been progress from '98, when our group started, to 2008? So that's the first one in 2008. And last year in 2009, and the lead author of the Asian audit Epidemiology, Costs and Burden of Osteoporosis in Asia is Ambrish Mittal, who's here today. And that was a very important document because no one had ever put that together before. And we launched that last year in Beijing. And then we got the national societies to work on a dissemination plan and a marketing plan. And it has really helped to open some doors to get people to have meetings in their health departments and some with their health ministers. So, as I said, the dissemination and marketing plan is probably the most important thing. We're working on a Middle East and North African audit to be launched next year, and a Latin American audit as well. So I can't stress how important those audits, whatever you want to call them, how important they are in terms of trying to get your message across to healthcare authorities. So just one example that I haven't put in here because I didn't want to be too biased, but in 2001 in Australia, we really had no idea what osteoporosis and fractures cost the community. People used to say it costs about 190 million, fractures and osteoporosis all up, and we knew that wasn't true. So we got a health economics group and a university and our key opinion leaders to develop the cost and burden of osteoporosis in Australia. And lo and behold, we found that it cost about $1 billion a year, costs, indirect costs and direct costs all up, lost earning, days at work, taxes, in looking after osteoporosis. And we got the health minister to launch that, and then we joined forces in a collaborative effort with Peter Brooks and the Bone and Joint Decade, with the Arthritis Foundation, with the orthopaedic surgeons to push for national health priority. And we really used that document, as well as others, really knocking on and driving all the politicians in all the states crazy. And in 2002, we did get national health priority status for musculoskeletal disorders. So that's just an example of using documents like epidemiological audits, costs and burden. So looking at some other examples around the world in terms of osteoporosis, and again focusing just on policy and advocacy, Osteoporosis Canada produced this Breaking Barriers Not Bones, and this was in the last 18 months. And again, this really was a naming and shaming document because it was really looking at all the provinces, what medications are available, what access to diagnostic tests, do people have to pay for it, what about getting to physiotherapy services, what about exercise, what about guidelines for vitamin D and calcium, and in fact all services. And they have really used that and used that to get more funding in the province of Ontario. So that was a really worthwhile product. And again, like the Surgeon General's report that we heard about this morning with the National Osteoporosis Foundation in the US, both those groups spent what probably everyone here would think was a huge amount of money on what they did with it afterwards, their marketing of that document. So they're just two other examples of using these sort of things. And the other thing in terms of the National Osteoporosis Foundation, they have a Strong Voices for Strong Bones advocacy group, and it's on their website. It's easy to join and be involved. And with things like advocacy and policy, you've got to make it really easy for people to get involved. Otherwise, as we know, they never will. So I'm just going to talk just quickly about the IOF and our EU work and call to action. And again, in terms of policy, you've really got to be specific. You've got to have tangible goals, because it's so easy to think, you know, a bit like losing weight. I want to lose 10 kilos in the next year. Well, you've got to, you know, hone it down a bit more and think, how specifically are you able to do that? Things like osteoporosis included in so many countries' health agenda. It's a healthcare priority, and equitable access to diagnosis, treatment and reimbursement, and keep doing the scorecards on a perhaps bi-yearly approach. And a bit like EULAR, and we saw Neil Betteridge talk so well this morning about what EULAR has done in the patient group. But again, we formed an EU parliamentary interest group about 8 years ago now. And so it just shows you how long things take to get going in policy. And a consultation panel made up of national societies in the 27 member countries, as well as experts. And got them together, they meet several times a year, and getting them to push on a local level and a regional level, and IOF pushing from the top, I guess, and working with the Commission and with the Council of the EU. And I guess the key words, and this is a policy session, so we're going to have a lot of these words, but stimulating the debate, advocating and collaborating with all these groups it has been what's helped us be successful to a certain extent. So in this document, this 10-year report, the number of fractures is stabilising in the EU, as we know in developed countries. There are more evidence-based treatments. Treatment options have increased in the last 10 years. There's been an increase in national program. There is greater awareness of the problem of osteoporosis and the need for prevention and what's available for prevention. And there's improved policies for diagnosis and access to treatment. But it's not perfect, of course, as we know. But again, like EULAR, we're very excited that the focus of the Belgian Presidential Conference is on chronic disease management, and we will be involved in that conference. Our President will be speaking there, and we'll also be involved in the EU conference the day before, on the 19th of October, the day before World Osteoporosis Day. And again, this year especially, we've been reaching out to EULAR in terms of working collaboratively to have musculoskeletal diseases on the agenda. So I'm just going to talk just a little bit about arthritis initiatives. And in terms of EULAR, even though the patient group and the patient story has always been a part of EULAR, a few years ago, as you heard from Neil again this morning, involving part1 and making a board a strategic decision to have patients more actively involved in the decision making, and Neil Betteridge is the Vice President of EULAR. And again, the Brussels Declaration in 2008 was very important, integrating people with rheumatic conditions in the workforce as well. So I think we've heard enough about that this morning that I won't go on about that. And then in looking at other achievements, looking at the United States Bone and Joint Decade, and even though that covers all musculoskeletal conditions, I was really impressed, and you look at their website and the key to some of their successes, they've been able to become a standalone Bone and Joint Decade group, which is really a major achievement. But the development of new and unique collaborative partnerships, which I think is extremely important. So multi-partnerships, so they have the patient organisations, they have government, scientists, corporate, media, all the medical schools and the allied health professional colleges as well. They have the osteopaths and the alternative medicines and the chiropractors. They have everyone involved, so everyone is talking to everyone else. And they make their policy tools widely available for all groups and on the net, again, making it easy. They have a section on their website, what you can do to get involved. And we're involved again in the burden of musculoskeletal disease in the US, and we saw that a major document this morning. But if you like, spearheading of all the other group activities, which I think is one of the major benefits or the pluses of the Bone and Joint Decade. So really, if nothing else, in terms of policy and trying to make that happen, the power lies, of course, in joining forces and collaborative efforts. So I just wanted to mention this quickly because I heard from several people, for some countries this worked. I mean, obviously it's not going to work for everyone, but at the Washington DC conference in '09, several people spearheaded, and over 20 countries visited their ministers or their ambassadors, if you like, on Capitol Hill. And some of them had really tangible outcomes in terms of getting in to then see their health minister and making certain events happen in their countries. So it's just another example. It wasn't a policy document. It was a bit like an awareness visit, but it was all about policy. And again, that expression, thinking outside the square or trying to do something different when the opportunity arises. So, what breakthroughs do we need in the next decade and beyond in terms of policy and advocacy? Well, I don't know exactly. We probably know what we think should happen. Musculoskeletal diseases should be a national health priority in these many countries around the world, and we should have benchmarks for that. That government supports the national societies, whether it's arthritis, spine care, osteoporosis, trauma care, orthopedic surgeons, and supports policies as well that lead to better improvement in treatment, access to and reimbursement for diagnostic tests and proven therapies, and also that new proven therapies have wider availability and people don't have to push for that for another 10 years, even after perhaps the medication has been proven to work.